Good morning and Assalamu alaikum. I am Lybah Tariq, the mini specialist at NICAT. Hope you all are well. Welcome to yet another engaging and insightful session with Miss Sarah Farrukh, sorry. And today we are going to be exploring another theme on bridging the gap, which is business analysis in healthcare and IT. Let me introduce you to Ms. Sarah Farrokh. She's a seasoned technology leader with over 2 decades of experience in project management, digital transformation, and business process reengineering. Currently, she's serving as the group head of PMO, business analysis, and software quality assurance at Dr. Ziauddin Hospital. Ms. Sarah has been at the forefront of driving digital strategy and operational excellence in the healthcare sector, and she also has a background in ERP implementation, software design, and health informatics. Sarah has expertise spanning both technical and strategic domains. She previously served at the Aga Khan University Hospital for over 22 years, where she played a critical role in shaping digital solutions for the healthcare industry. She also holds a master in computer science database administration from FAST. Um, Welcome on board, ma'am. We are really grateful for you to have taken out time for us today. Um, Please take it over.
Thank you so much for the lovely introduction.
You're
Uh,
welcome.
Thank you so much. So now our today's topic is related to how the importance of the business analysis in healthcare IT, and why is this important for any healthcare setup to have a business analysis.
Right.
So it
Sorry to interrupt you, but before we get on with diving right into the topic and diving right into exploring the theme, do you wanna share with our viewers a bit about your journey into the healthcare IT and business analysis and this particular field?
sure. So uh, around 2 decades before I actually graduated from FAST Institute. And after that, I have joined Afan University Hospital, and there I have worked on number of like systems and projects that involve both healthcare related systems and the education related systems, EHR implementations, and I have done a number of projects over there. And after that, I have switched to Dr. Zaudin Hospital. And after that, I have decided to switch to the academia, and now I'm serving in Sir University, because what I feel is that there's a vast gap between our academia and the industry professionals. So to bridge that gap, it's very necessary that somehow our professionals should contribute to the academia, to the universities in their own capacities. So that's it.
That's amazing. That's greatly inspirational. Um, I hope the audience can take some inspiration from that. I hope it gives our viewers a bit of an insight into how they can also make their way in the similar field if they aspire to. Now, please tell us about business analysis in healthcare IT and particularly how to bridge the gap, which is also the theme that we're exploring today.
Sure. So this is my a brief introduction, which we have already discussed about. I am about 20 plus years of experience in the IT industry with different verticals, and I have already served with the leading hospitals and universities. So um, let's start with the different kinds of opportunities. First, we will start with the opportunities that are available for the healthcare startups. What's the landscape of opportunities? Then we will look into the challenges and how the business analysis can help them overcoming then those all the challenges. So um currently there are various opportunities available, right, for the telehealth, because during the times of COVID, this is one of the area that is really taken off, because there were health issues in pandemic. So at that time, this telehealth, although some people were doing it initially, like some people were doing telehealth projects like our Akhan Hospital, because Akhan Hospital has existence in remote areas as well. So over there, there were some projects going on, and there are some other startups as well, like Sehat Kahani. But with COVID, this area is really boost. Then we have wearables. These wearables are basically for your own wellness. These are IoT devices which anyone can wear to monitor their health. Uh, there are various indicators like BP, heart rate, which can be uh, monitored by using those wearables. Then we have AI diagnostic. AI has got a lot of boom, but in and it's like making uh, task of lot of people easier, where the like in case of we can have disease, like you can say disease identification, right? Disease probability through the AI diagnostic, right? You can feed in patients' data and you can check that what are the patterns, what are the what are the health risks associated with that person based on the age and other conditions. Then we have different EHR plugins. There are a number of EHRs available, and they offer various kinds of plugins over there, right? So, what are the basic challenges in the healthcare setup? Healthcare setup is very complex because there are a lot of stakeholders involved in those settings. Like there are primary health care providers like doctors, nurses. Then there are financials, right? And financials are not simply the billing of the patients and the patient paying of the bills. It also includes the insurance claims like patient aids, welfares, right? Then there are integrations, a lot of integrations with these systems. Like if a hospital has a EHR that it's not independently working, there are integrations of the EHR system with the other systems, right? So it's very hard to build a holistic healthcare ecosystem which can cater the end-to-end need of the whole healthcare setup. Plus, as we are dealing with the patients, so are various issues which are related with the data privacy and their regulatory compliances. There are certain compliances that any of the healthcare setup has to um, confirm, right? Then, as we are dealing with the patient data, which is itself is very like sensitive, so there are security concerns. So, and another challenge which is very much seen for adapting is the user adoption, because the the basic users of these healthcare related systems are healthcare providers, and we must understand that using the system is not their primary job, right? They have to see the patients, they have to take care of them, right? So in that case the user adoption becomes very difficult, because if your user interface is so much clingy, it has a number of fields, it's very complex, and they cannot easily enter anything. So it's very difficult for for the doctors and the nurses to adopt that particular system. So this is the very big challenge which even now the hospitals are facing when they are going for the EHR and they are pushing their clinicians to put the data in the system. Then we have interoperability issues. No system can run alone. There are certain systems which are the legacy systems which needs to be integrated with the EHR. So there are some interoperability issues as well. But the goal is to improve the patient outcomes, right? That what the patient is getting, what kind of care is getting, they are getting while optimizing the operations. So for the startups, what they need is more than the tech. They don't just need the technology, but they also need to understand the process and their insights to give the better solutions, right? So there are different personas, there are different stakeholders which are associated with the healthcare setup. We have the clinicians, which needs the minimal clicks. They always want that the uh, the system must help them in making the decisions. They should guide them. Then there are administrators which needs a good return of investment, ROI, and regulatory assurance is one of the basic need of these healthcare systems. For patients, they should have a good user experience. Data privacy is an issue for any of the patients. So for patients, these things are important. So what are the stakeholders in the healthcare setup? We have hospital administration, we have doctors, clinical labs, patients, insurance companies, government departments, because data is being sent and received from the government department, and healthcare setups have to provide the data to those departments. Then we have there are different hospitals which network with each other. So network hospital, public health department, NGOs. So these are all the stakeholders. So any business analysis helps all these stakeholders that to cater the needs of all these stakeholders in an aligned fashion to make a proper hospital ecosystem. So what are the superpower of the business analysis? Ensures assumptions testing. Like if there is any problem, so there is a solution. First, they will analyze what the problem is, and for that, there are different methods by which we can check that what is the problem. For example, you can directly visit those places. For example, if you are in a lab setup, you need to go through the whole cycle. Once the order is placed, the specimen is collected, then it's transported to the other department, and so on. For that problem, there is a solution hypothesis. There is a proposed solution, and with that proposed solution, our prototypes are made, and those prototypes are then provided to the user, and then after the user feedback, the prototypes are fixed. So through this thing, we are closing the loop with the stakeholders. Then it also helps to uncover the hidden workflows by ensuring all the stakeholders engagement. It does risk mitigation, because when we build a certain flow or a cycle, then those flows uncover the hidden security or compliance risk. And we have other tools as well, like requirement traceability metrics that ensures that we are fulfilling the requirements, right? So, what are the business analysis tools uh, that are being used in the healthcare setup specifically? So, some of the tools we can use in any context, but some are specific to the hospital setup, like shadowing or contextual inquiry. Like if you are designing a system which has to outpatient system which has to cater all the outpatient outpatient activities, then you have to observe the workflows, that okay, how the appointment is being given, when the patient comes, what is the wait time, is how much is the waiting time, how we can reduce that. So these kinds of questions. Then there are interviews and workshops with this specific stakeholders of that setup. For example, appointment booking staff will be a stakeholder in that case, right? Then the nurse who is taking the vitals, and the doctors, and then if the doctor is prescribing the medicine, then pharmacy. So uh, the workshops is created to get the insight of the process. Interviews are done, workshops are created. Then we can have surveys to get, like for example, if you want to get the patient feedback, right? Then you can have surveys, and you can have them on online tools by which you can really check that what are the basic pain points in the whole patient journey, right? Then we have patient journey mapping, because whenever a patient is encountered in the hospital, whether the patient is an inpatient or an outpatient, there is a certain flow that the patient has to follow. So that particular journey has to be documented really well, and all the happy scenarios and all the alternative flows needs to be documented to get the pain points. Then we have process modeling. For modeling, we can use business processing model and notation. For that, you can use any of the tools that you like Lucid Chart, Microsoft Visio. Then use case diagrams are important in that case. These are all the stuff that is being used to clarify the requirements, that what are basically are that what our stakeholders want. Then there are similar diagrams, because in a hospital any department cannot work in silo, right? There are handoffs between the roles, between the department, for example, nurses, doctors, pharmacy, billing. So to clarify them, we can use the swim lane diagrams. Then requirement traceability is very important at each and every step of producing the solution, right? It can be in the form of user story backlogs, right? Because when you create the backlogs, then they should clearly indicate that to which requirement they are mapping. You can use different kinds of tools to map those backlogs, and user stories like Jira and ClickUp. Then we have the traceability metrics. These are simple spreadsheets. Then that basically tells that okay, this is the requirement, and how are we going to fulfill it. It will lead the use cases and the test cases. Whoever has given the requirement, they need to test the system and provide the user UAT sign off, which is basically the UAT acceptance testing. And this is very critical for any solution to get the UAT sign off. And in case of healthcare setup, it is more sensitive, right? Because you are dealing with the patients and the patient care. Then for documentation, you can use Google Docs for living. You can make your business requirement documents, but it's very important that those documents are the live documents. For example, if there are any changes, you need to go to that particular process and change that. So you have to keep your documents updated. Um, and there is another very important tool, because we need to understand that our stakeholders are not the IT experts. They cannot tell us that what they do really requires. So for here, prototyping and wireframing really help us, in which we can create screens, and we can create the basic workflow, that how the data will flow from one department or from one stakeholder to the other stakeholder. So you can use different tools for user experience design. uh, you can use Balsamic, right, and mock-up portals. You can make dashboards, right. So after that, then comes the testing and the validation part, which I already have uh, told that it's very important. Proper sign-offs required, test trail. Uh, it's recommended to spend like considerable amount of time in this phase, and it should be properly planned. The For example, I can give you an example. For example, if you are rolling out a specific feature, like in hospitals, there is a feature of discharge summary. Whenever a patient is discharged, so a discharge summary is created. So when we implemented that particular feature, we haven't rolled it out across all the departments. We have taken a single department, uh, like for example, PEDS department, and we have rolled out that particular feature in that small setup. So all the glitches are known over there, and once the process is streamlined, then it's rolled out in other department. So this is called pilot. So pilots should be done in the critical setups like the healthcare. You should not plan for the big bang rollouts or implementation. Instead, you should uh, pilot them on a smaller volume of uh, data, and then you can, once pilot is successful, and it's possible that pilot can run for 2 months or 3 months. Once it's successful, it's streamlined, then you may need to roll out the same to the other departments. So, right, what if the B is not there? So, if the B is not there, so there is a high probability, then there is a gap between the design and the actual user task, because there are no workshops, there are no shadowing. People don't go into the uh, healthcare setup and see how the actual work is being done. They just rely on the interviews. But I'm telling you that this the when you observe the things by yourself, then they provide you a better visibility, right? Then we have compliance roadblocks, right? For example, HIPAA compliance. For the hospital, we have HIPAA compliance, like some of our data should be data. There are certain data privacy rules that, okay, if anyone is requires a patient data, so the data should be encrypted, and you should not disclose the data without the consent from the patient. So for that, different methods are used, like patient for data privacy. You can use encryption and things like that. But the thing is that if the proper business analysis is not being done, if the regulatory requirements not properly figured out, then there are high chances then people can miss those. Then scope creep. Scope creep is an issue which I can say that it can happen with business analysis as well, but it reduces the probability, uh, because whenever a user is giving some requirements, and after some time they got some more clarity, and they are adding on more and more requirement, so it tries to stop the scope creep. Then we have change management and adaptability, because there is a very very much resistance is faced from the clinicians, because if a nurse is like doing a work on the floor, then he's taking care of the patient, and we usually faces such kind of resistance that okay, we don't have the time to put in these things in the system. So for that particular thing, what we need to do is we need to have a very good UI UX, right? Uh, like easy data entry. And the other part is that the change management is plays a very important role, because it's not like that you can one fine day you come and say okay, from like after 15 days we will be using the new system. So that will not be acceptable. So change management, there are like proper announcement. Uh, all the stakeholders need to be engaged one way or the some other way. There should be notification. There should be announcements. Okay, some that a new process is coming up, a new system is coming up. You have to use those systems, so that through these kinds of techniques we can have the change management easily, and user would be able to adapt the new process easily. Then we have investor doubts. If we have lack of documented rationale for feature prioritization, so the stakeholders lose their confidence. And for business analysis, there are certain scenarios in which the analysis leads to paralysis. So we also need to cater those kinds of scenarios in which we are too much digging into analysis and there is no output. So these things needs to be catered, while one should be very cautious about uh, doing the business analysis, that it should have a deadlines, a clear plan, so that you are not missing your deadlines, right? Plus, you also need to have a support from senior management, because as I have also mentioned in this slide, that change management is very difficult. And if the change is coming from the actually change needs to be coming from both top down and bottom up. You need to engage both kinds of users, like your top management in any organization, in any healthcare setup, plus the stakeholders which are doing entry in the system. So senior management buy-in is very necessary in these kinds of initiative. Now we can check some use cases, a telehealth startup in which we have initial MVP as basic video call plus chats. So in that, a discovery phase was launched, and around uh, 2 weeks are spent in the clinics, that what are the physicians doing, what will be the roadblocks while they will be doing the video calls. Uh, then there is a PA intervention, right? So a whole process flow is designed, call chart, code chart, how the system will get the patient will get the prescription, of the patient will be charged. So these things are all documented, and then UAT is performed. You can call it a pilot as well, in with 10 clinicians, so that we can have a data by which we can get the hiccups of the hiccups faced by the clinicians, and we can resolve that. So outcome is that adoption jumped from 15% to the 45% of the trial user, and uh, time is reduced by the 60%. Then in healthcare setup, there is another. you can say a pain point is ICD coding, because there it's a kind of regulatory compliance, and all the good hospitals are doing it currently for every disease. When the patient is diagnosed with some disease by a doctor, then there is a coding standard. Okay, this is the disease, and that particular code is assigned to that patient which has that disease. And not in our country, but in like other countries, this is also linked to the insurance claims and other things, right? So this is very important because doctors find it very difficult to get the correct codes and associate with that particular patient. So for that, this particular issues, be interventions were done, right? So there are sometimes in some setups there is a scenario that doctors are not being able to provide the correct coding. So there in hospitals there is a separate department which are called the coders, and then though they associate the codes. So in this B intervention, the code some time is spent with the coding specialists, that how they are detecting the code, and physicians, right? uh, and then some pain points are identified, like there are manual searches, there are different tabs which are being used, right? So workflow alignment is done, right? For example, if a uh, doctor is of some specialty, for example, if it's a German doctor, so they can have their favorite list and they can select from their list, they can add in those lists. So pilot is done in three rapid duty cycles with coding teams, and then it is dropped, or there is a reduction in time to code, and there is also accuracy is also increased, right? So you like Lybah, right?
Yes.
I do I have more time, or
You do, ma'am. How much more time would you need?
5 minutes?
Absolutely. Absolutely. Sure.
Sure. So then we have another case study which is related to self-care cardiac assessment, right? It's basically a remote patient monitoring tool, which patients are wearing at home, like weight scale, BPs, right? Uh, so through IoT devices, the alerts are sent to the clinicians. Okay, that there is a problem with the patient, there is a red flag, but the issue in this particular case is that they are false positive, they are not giving the correct data. So in this particular case, interviews are conducted with the cardiology nurses and doctors, and then the alerts are redesigned. Alternate logics are redesigned. Smart alerts are made. The data which is giving the false positives are is analyzed thoroughly to get the proper smart alerts. Then dashboard simplification is done, right? Uh, it's like we have added color, red, yellow, green status. Okay, the patient is in danger, out of danger, those kinds of things, right? So false, like in that particular case, there is no problem with the device, there is no problem with the alerts, but the problem is with the incorrect logic that is being built. Incorrect, so those are corrected. So false alerts drop by a considerable amount of time on, and then the time required by the clinicians for per patient also drop. So these are a few use cases that I have discussed to tell that what is the benefit of the business analysis, and how business analysis can help in having a better healthcare system. So that's all from my side.
Thank you so much, ma'am Sarah. It was extremely insightful, extremely comprehensive as well. I must say, all the questions when I read the title and I was like, okay, business analysis and healthcare, like you saw all the random questions that were popping in my head. This presentation has addressed all of them, starting from what is business analysis, which I'm also going to summarize by the end of it. But you have taken it so coherently and precisely, step by step. Really appreciate it. It was really really helpful. I hope our viewers, anybody from the healthcare industry, people and our founders aspiring to build solutions in the healthcare industry. You have highlighted such great opportunities for potential, solutions to be built on. So people in the healthcare industry, founders in the healthcare industry, this session has highlighted so many opportunities for you to tap into. So many problems. This session has highlighted so many problems that you can build solutions for. So just a few questions on a final ending note. Since we are talking about the entire healthcare business analysis sector and everything, and since you have an extensive experience working in this sector, people and our viewers, any founders, anyone who is remotely related to the healthcare industry, what tips would you suggest or what would you advise to them, that what are the most critical skills for someone looking to enter into the healthcare business analysis?
Uh, for business analysis, I think you should have like a critical thinker, out of box thinking, because there are certain solutions people are doing same and same thing for 5 to 10 years. So they need to have a fresh look at all those things, and to give them a better perspective, a better solution, right? Then the communication skills uh, matters a lot, because business analysis have to, it's basically a bridge between IT and uh, the healthcare, right? So and they have to talk to a number of stakeholders,
Stakeholders.
like we have already discussed that there are a number of stakeholders. So these are few of the skills that they should have, basically.
Perfect. That's amazing. Finally, this question is coming coming from the perspective of helping and addressing to, if there might be any questions from our viewers for particularly the students or like young professionals who are beginning or who are at the starting point of building their careers at the in the intersection of healthcare and IT. So what should be an ideal roadmap for them? People just starting out to build their careers on the intersection of healthcare and IT. What should be an ideal roadmap? What ideal steps should they follow?
uh, like for the uh, any of this any of the people who want to start their career as a business analyst, you are talking about how they can dwell into this career.
Absolutely, absolutely. Generally, not just particularly business analysis, but just generally, any career that comes at the intersection of healthcare and technologies, particularly, business analysis. So, what should they look up to? What steps should they, take up? Skills we've already discussed. These are the skills that you must work on building in yourself. Similarly, what is an ideal roadmap for somebody entering into this, somebody who wants to enter into the field of healthcare and IT, the intersection of healthcare and IT?
Okay, so
I'm sorry, just sorry, really sorry to cut you off. I'll tell you a bit of the context for this question. So, with AI and intelligence taking over, and with the global digitization at this moment taking place, which is at a at a very fast pace. So it's almost unavoidable for any department, for any field to not be affected by the digitization, right? Similarly, people in healthcare, and we're in this process of changing the mindsets. that no field, no job, no task is going to stay unrelated from IT in the coming times. So this question is coming from the perspective why I was emphasizing on the intersection was that we have people working in the healthcare industry already, but for somebody to to prepare for this transition where IT is going to become a very integral part of every field of every operation, quite literally. So from that context, like what is an ideal journey to start with the right with the right steps to begin with?
So, uh, the, actually, what I have seen that people from different perspective, like they can come from the different, because business analysis, as we have discussed, that it's a bridge between IT
Right.
and the hospital setup. So, what I have like. Uh, some people from the hospital setup also comes into this role, and some from the IT setup also comes into this role. Regarding your question about AI and the new technologies coming in for the business analysis role, what I can say is that this is the role that will drive these initiatives, because you need to understand the process, you need to understand the workflows, and you will be basically driving all those AI driven initiatives, because someone has to tell, okay, what is basically the requirement, or what are the steps, what will be the workflow. So those initiatives are like the you can say prerequisite of all those are business analysis.
Perfect. Perfectly summarized. Thank you so much for your time. Thank you so much for being with us today. Finally, before I close it off, do you have any final thoughts on the future landscape or on the future of business analysis in the healthcare industry? And then I'll wrap up the discussion, and that will be it.
Sure. uh, I can see a lot of potential in healthcare industry, because uh, right now we are talking about the integrations with other system like the AI tools, decision support system, and there is a lot of stuff in healthcare setup. As I have already mentioned in the discussion, that clinicians primary role is not entry in the system or things like that. So what I see is that these roles will be shifted to AI or in near future. So what I feel is that there are various areas in the whole healthcare system where we can utilize uh, AI, machine learning technologies to get the work done more efficiently, and we our healthcare providers can focus on the like their core competency.
Perfect. Thank you so much. For all the viewers, I'm going to summarize the discussion today. The theme that we explored today was bridging the gap, under which we explored and we discussed the business analysis in healthcare IT. Ms. Sarah started with highlighting the opportunities in the healthcare startup industry at the moment. She further explained the challenges that the healthcare IT industry is currently facing, and what startups need to do and what startups need to come in at. We also discussed the buyer personas, the stakeholderships. We moved and we discussed and we explored the superpower of business analysis, and how business analysis is going to be a very critical, a very pivotal part of integration between the entire processes. She also discussed and she also shared with us various tools for business analysis, from process modeling, equipment traceability, documentation. We also discussed the tools that can be used in business analysis for testing and validation. Finally, we moved on to discussing the consequences of missing business analysis in the industry, in any operation in the processes. And finally, she shared some of the use cases in which we got to see, the benefit, the impact that introduction of the business analysis procedures made. Some of those were, self cardiac arrest assistant, telehealth, and finally we discussed. So yeah, I think I've missed one of the use cases, but yeah, for
Coding
all
assist,
not sorry.
coding assistant.
Coding assistant, absolutely. So for those of you who could not watch the session till the end, you can find it on our YouTube. The recording will be there, and I think today's session was extremely insightful, extremely helpful, because she touched and tapped onto the very right points for the very right audiences, and whatever our audience would have, I guess, wanted to understand and explore under this theme. So thank you so much for today. Thank you everyone for joining us. Hope you all have a good day. Take care. Allah Hafiz.
Thank you so much. Allah Hafiz.
You're welcome. Allah Hafiz, ma'am.